Hello, this is Dr. Gage from First Look MRI, and this is a 21-year-old male with complaints of right groin pain, pain in the periumbilical region which shoots down into the groin, and they have one of the most subtle cases of a sports hernia I've seen. So athletic pubalgia or sports hernia is just an injury of this aponeurotis that comes down and wraps around the symphysis pubis. Normally you can see these a little bit better. This is just very subtle, almost missed it. But on this axial image here we see, if we really window down, there's a little bit more hyperintense signal on this stir sequence in the right pubic bone, and on the left is normal, low signal. And if we go to, let's see, another sequence here, there it is. I put some arrows. We can see the common rectus abdominis adductor longus aponeurotis, this broad aponeurotis attaches here on the left. This dark band looks normal. On the right-hand side, though, we see this vertical band of brightness. There's a little bit of fluid right at that periosteal interface. So just a really subtle sports hernia, as evidenced by these two things. Now we're going to try to confirm this by looking on other views. On the T2 weighted sequence, boy, it looks absolutely normal. You cannot see the marrow differences. This is part of that aponeurosis down here along the bottom. Usually when they have an injury, you can see it right along here or right along here. You see a primary cleft going off to the right or left, but this looks absolutely normal on this view. So it's super easy to just jog past. If you look on this one only, even if we go up to the rectus abdominis muscles coming down, don't really see much going on there. So that could be easily missed. Now let's put up the sagittal image. Oh, but before that I'll do the stir here. So this is the bottom of the aponeurosis where we typically see the tear. And on this view you can see that there's some just subtle brightness on this side here. And if we go one more cut over here, you see some minimal asymmetry, but boy, this would be super easy to jog past on this coronal image. So I would say you really cannot see it on the coronal images. If you just saw this, you'd say, yeah, looks pretty good, and maybe jog past this subtle marrow edema. Now here's a sagittal view where we can see the rectus abdominis muscle. This is the tendon. This is the aponeurosis that wraps along the undersurface here, along the anterior margin. And here's the adductor longus coming up to form the bottom part of that aponeurosis. And here on the left side, everything looks nice and clean and dark and uniform. Now we're going to go over to the right side. This is just slightly to the left of midline. Now here, right in the middle, there's a little dot there in the middle, primary cleft, which is not too surprising or abnormal. Now if we go one to the right of midline now, right there. So that's where we can see the abnormality. Let me zoom that on up. Zoom. And now you can see that little abnormality. There's that central part, and then right to the right of midline. It goes from the central part over there. So very, very subtle finding, super easy to miss. Here's the left normal side for comparison. And then here's the right side again. So very subtle sports hernia on the right-hand side, explaining their right-sided groin pain.